Next up, we visit the City of Brotherly Love, where independence isn't just a word, it's a foundation, committed to improving access to primary care and behavioral health services, enhancing educational opportunities in the healthcare workforce, and enabling solutions for greater health equity. The Independence Blue Cross Foundation has been a fearsome force for over a decade. Let's see how their work is creating opportunities for veterans.
My name is Reverend Dr. Lorena Marshall Blake. I'm the president of the Independence Blue Cross Foundation. The Independence Blue Cross Foundation has been around since 2011, and it's working to provide health care and equity for everyone.
My name is Heather Major, and I serve as the executive director of the Independence Blue Cross Foundation. The Independence Blue Cross Foundation is a very proud funder of health initiatives here in the Philadelphia region. Our work cuts across 5 counties of southeastern Pennsylvania, including Philadelphia County, Bucks County, Delaware, Chester, and Montgomery counties. We're very lucky to have Thomas Jefferson University as our education partner in this effort. And we're very fortunate that through them, they have Jefferson Health signed on to make sure that these students graduate with a career opportunity.
My name is Marie Ann Marino, and I'm Dean of the Jefferson College of Nursing at Thomas Jefferson University and Vice President for Nursing Partnerships at Jefferson Health. We have 1,500 students, and I try to get to know them and just interact with them wherever they are. I was a pediatric nurse practitioner in New York working with victims of child abuse, and I wanted to seek a doctoral degree, but was challenged in the ability to afford that. So with a girlfriend of mine, I enlisted and was commissioned as an officer in the United States Naval Reserve Nurse Corps and worked as a reserve officer for 6 years. And was stationed out of Bethesda Naval Hospital, and that afforded me the ability to seek a doctoral degree as the military gave me financial support to go to school, and I went to Teachers College, Columbia University.
My name is Anna Bernal. I'm a student at Jefferson College of Nursing. I'm also in the Army Reserves, Mortuary Affairs Specialist. Being in the Army has been thrilling, unforgettable experience. No day is the same. I have gained many very close friends, and I've been able to go places I've even dreamed of.
I wasn't part of the military, but my background is military connected. So I grew up in a different part of the state. I had the opportunity to go to school as a first-generation traditional student, which took our family into very different directions had they stayed where they grew up. So I feel very connected to this initiative personally, and professionally, I know that it is absolutely the right thing to do. We have a big responsibility to make sure that we're allocating resources for the greatest impact. And I can't think of a better opportunity for veterans to have a meaningful purpose in their civilian life, and hopefully they choose that to be a nurse or at least be part of the health workforce.
The Service Scholars Program is important to the community because I believe it gives our veterans an opportunity to go back to school, to go back and not have to worry about debt, to look at the opportunity to further their careers, and really to help, I say, the nursing shortage. They have their skill set where they've actually been on the front line and sewing people up and doctoring people up and bringing them back to health.
I have had a tremendous interest in supporting veteran students and students with military backgrounds, but it wasn't until my partnership with Independence Blue Cross Foundation and the funding that they have given to us that I am able to support our veteran students and military connected students in substantive ways.
Being a reserve means essentially part-time soldier, full-time civilian. But sometimes you're thrown into deployments and you're in the role of a full-time soldier. And when you transition back into civilian life, it isn't always the smoothest. You're used to this lifestyle where your meals are provided for you, you have a certain time frame that you have to meet, and transitioning into the civilian life, you're kind of on your own.
Yeah, everything is about timing and geography. We're in the right place at the right time to be doing this kind of work.
Heather often says timing and geography. So I think the two have come together as we move forward with the program. We're at the beginning stages of it, but I just see it in my mindset rolling out. I see this as a national model for not just the state of Pennsylvania, but for the country, and a way to step forward and do something for our veterans that makes sense.
We owe it to our military to help transition them back into lives and careers, and this support is helping that. I mean, we have been pulling out all the stops at Jefferson. We even have a service dog that we've obtained through Leashes of Valor. Their dog that we have, Maggie, supports all of our students, all of our frontline staff, and really makes everybody's day just a little bit better.
We're very fortunate to have a mission-driven organization supporting our work. Independence Blue Cross has been committed to this community for 85 years, and our foundation, the Independence Blue Cross Foundation, is an extension of its 85-year commitment.
When I think of Jefferson, who has stepped to the plate with regard to this, they are not only going to do internships, they're going to do externships, they're going to work with them, they're going to work with the Yellow Ribbon program and make sure that the dollars are there as we partner and collaborate with them, so when the veterans come out, they'll be debt-free. I mean, it doesn't get any better than that.
One of my greatest support networks has been Jefferson University. They have helped transition go from military to civilian a lot smoother. They took this huge weight off my shoulders without having to deal with all the financial burden.
I do believe Independence Blue Cross Foundation have found a way to serve our veterans and to work with them.
This partnership will be transformational, and I will be able to recruit more students with this background and really transition them into academics and prepare them to be nurses, but most importantly, transition them to their first role as a nurse in ours and other health systems.
A piece of advice I would give out is that to just take it one day at a time. You don't have all the answers. It's okay to ask questions.
Find a partner, whether it be an employer or an academic institution, that will truly value the unique skills that you bring.
You make sure you have your support system to make sure you always stay on track. And don't be afraid to reach out to programs like this, because I didn't know this existed and it completely changed my life.